Post-treatment maintenance following invisible orthodontics is essential to preserve the functional and aesthetic results achieved. This stage extends beyond the use of retainers and involves active monitoring of factors that may compromise dental stability over time. Maintenance includes the continued use of removable retainers during nighttime rest, periodic checkups to evaluate occlusion, periodontal status, and the integrity of supporting tissues. Therefore, it is crucial to monitor for possible unwanted movements, signs of bruxism, new occlusal interferences, or recurring dysfunctional habits. In addition, it is indicated for all patients who have completed orthodontic treatment, especially those with a history of relapse, significant bite corrections, rotational movements, or space closure. In turn, it is indicated to reduce or eliminate maintenance without clinical justification. However, it is not recommended for patients with poor oral hygiene, irregular use of retainers, or the presence of uncorrected harmful oral habits. In summary, a well-structured maintenance plan is essential to prevent relapse and protect the therapeutic investment made. Thus, periodic clinical evaluation, prolonged use of retainers, and monitoring of biomechanical and functional factors allow the achievements of invisible orthodontic treatment to be consolidated in a lasting way.